Thank you so much, all of you, for joining us here today. So my name is Nora Lázaro. I am Patient Engagement Manager at EURORDIS Rare Disease Europe. I know most of you here, I think. But here we are here to talk about the Patient Partnership Hub, why and how it was built, and most important, what you can do with it, what you can find in it. However, first of all, I would like to get some information from the audience before going into business. So I'm going to launch a little poll now, and maybe you can let me know, let me see, launch, whether you are a patient representative or healthcare professional, project manager, or maybe other. Responses are anonymous, so and you might tick more than one. Okay, so I see we have okay, 24 responses out of 32. That's a good number. Okay, I think most of the audience is patient representatives or project managers, and most of them are familiar with the patient partnership, which is great. Can you see the results, or it's only me seeing them?
We cannot.
Okay, so I'm reading them for you, maybe because I'm the host. Okay, I'm gonna end the poll. Maybe if I ended it, you can have a look. But again, reiterate that most of you are patient representatives, 68%, 32 project managers. We have some healthcare professionals as well, which is great to hear. Other, and then most of you are familiarized with patient partnership. Voila, I think I'm sharing now the results, if I'm correct. Anyways, thank you so much. For those of you that answered that you are not familiar with the patient partnership, no worries, you are in the right spot. So we will go through it as well together. Today's agenda, we will have, as I mentioned, an introduction to patient partnership, what it is, its added value, as well as what is the hub, the patient partnership hub, and its objective. Then we will also explain how we turn the hub into an idea to a reality and its current structure, leaving also enough time to explore the hub with a live demo. We will also explain what's next in terms of dissemination and content sustainability of the hub. And we will also have some Q&A time at the end, but also during the session. So don't hesitate to raise your hand or type in the chat whenever we open for questions. I wanted to share here with you the definition of patient partnership that it's included in the patient partnership framework, just a bit of context. So this was developed together with patient representative, project managers, and clinicians from different ERNs, and it was published October last year. You will have the link on the slides that I will circulate later as well. So according to this framework, patient partnership, it's a mutual relationship between patients and healthcare professionals, where input from people living with a rare disease or caring for someone with a rare disease routinely and formally informs the network's collaborative activities and decision-making. And what it implies is considering healthcare professionals and patients involved in the networks as equal partners in all ERN activities and domains. So why it is important? There is an added value here because patient partnership is crucial, allowing that patients and carers, they share their expertise as expert by lived experience, and they contribute to shape decisions on what questions should be addressed, the methods used, and when. And also this is particularly relevant for their rare disease environments. Now, the Patient Partnership Hub, it's a dedicated online platform. It is designated to support the implementation of this patient-clinician collaboration that I just explained, the patient partnership. And we envision it as the to-go place to find resources on patient partnership, including guides, tools, and best practices. Before the hub was set up, we had already these resources out there. However, they were scattered, they were difficult to find, and therefore they were unused, they were being unused. So thanks to the hub, we want to move into a scenario where resources that support this collaboration are in a single place, they are intuitive to find, they are up to date, and for sure they are useful, they are put into action. So the resources in the hub include a clear methodology for patient partnership. They contribute to understand how clinicians and patients have collaborated to achieve a given outcome. And the bottom line is that all the resources and tools in the hubs, they serve to inspire others and replicate the project or initiate a similar one. That's why you will see that most of the resources are not condition related, but they are more about the methodology used to achieve certain outcome. The hub is to be used by you, healthcare professionals, patient representatives, and or project managers to better collaborate together in healthcare networks. Particularly, it's thought for the ERNs, for the European reference networks. We can highlight 6 main objectives of the hubs. First, it enhances this patient engagement in healthcare networks by promoting the active participation of patients in different activities and decision making. It also facilitates knowledge sharing, providing a centralized repository for that. It also supports skill development, offering tools and guides to the end users. It also promotes best practices, highlighting successful models and frameworks for patient partnership and encouraging their adoption across various healthcare settings, as I mentioned before, inspiring others. It also adapts to evolving needs, ensuring the hub remains a relevant and valuable tool for all of you. And we also wanted to ensure accessibility to this open resources safe space. Let's now talk about how we turn the hub from idea to a reality. First, what we did is we secure the budget, and I've pasted here the logos of our funders for this project. Then in October 2023, we launched the call for expression of interest to EPACs and project managers in the ERNs to be part of what we call the Knowledge Management Working Group. And it's a EURORDIS transversal working group that would execute and help and support the execution of the project. The group met 4 times a year online, and there was constant offline work till the publication of the hub. So in Q1 2024, we got the content ready by mapping all the resources that we wanted to have in the hub, and also we agreed on a first taxonomy, a classification of the resources that would make sense to us. Then in Q2 2024, we brainstormed and we had large discussions about the functionalities of the hub, and we agree on those. We also mapped and addressed the accessibility needs that we needed. For example, for visually impaired people, that they could access easily the hub. And we also ensured the data quality of all the resources that were going to be included in this hub. Then in Q3 2024, we had a first draft already of the site. We call it the mockup. So we were testing it and adjusting it together with the web developer. And we also were working towards the design that you now see, like the logo, the color codes, the fonts, always making sure that it was addressing the accessibility needs that we mapped before. And finally, we are now in Q2 2024, Q4, sorry, and the hub is live. We have the patient partnership hub that is now live in the EURORDIS website. The dissemination, it's ongoing, as for example, with this demo webinar. And we are also implementing a protocol of usage of the hub to ensure its sustainability. This is about the structure of the hub. I wanted, before we go into the demo hands-on experience part, I wanted to explain you a bit how the hub works. So there are 3 ways of searching. The first option would be searching by keywords. So keywords are terms that can help you find information, tools, guides, whatever about a specific topic. And we have left here like some examples that you may use, for example, patient journeys, or you may look for foundations, documents, like really the core of the patient partnership, like for example, the framework would appear there, or clinical practice guidelines. You might be interested in evaluation, maybe when the evaluation in the 2027 comes. So this is the keyword search option. Then there is another one that we have called the area of work search. And this also follows the structure of the patient partnership framework, which proposes 5 areas of collaboration for patient partnership, and they refer to the main activities domains where this collaboration takes place. So we have network strategy and management, we have healthcare, we have education and training, we have clinical research and registries, and finally we have information and outreach. And then we will also have a third layer or a third type of search, which is the option by type of resource. So in here, you can choose whether you want to search only guidance, or maybe you are interested in good practices only. Maybe you are looking for tools to actually develop a certain project, or maybe you are looking into skills. So all these 3 search options, you will see now that they are interoperable. And also the results are automatically displayed in the page of the patient partnership hub according to the search conditions you would have chosen. You don't need to refresh. So I think this is enough theory. Let's now move to the demo part, to the live demo. But before, is there any questions so far? Andrea, please let me know, because I sometimes when I share my screen, I don't see the audience very well, hand raised.
I don't see any hand raised.
Okay. We will have more time for Q&A
Question? No?
later. Okay. So let's click now to have a look to the patient partnership hub. So as you can see, it is hosted in the EURORDIS website. You can access it via the link that we will put now in the chat. And there is also, like, if you arrive to the EURORDIS landing page, the homepage, you will see that you can access it through it as well. So it's quite easy, quite intuitive. Then once you are in the patient partnership hub page, it follows a very simple structure. So first you will have this introduction of what it is, our logo, and then also you can, if you click here on how to find resources in this hub, basically you will have a fact sheet with everything that I have explained to you before. And you will have more information also about all of the areas of collaboration and all the types of tools that you can find. Then if we scroll a bit down, we will have the search engine part. As I mentioned before, we have it by keyword, we have it by area of work, and we have it by type of resource. The hub works that the moment you arrive in it through the general link, all the resources will be displayed below by default. You can sort them by newest first or alphabetical order. And then there are 9 displayed in the page, and you can basically navigate through them, navigating through the pages number here. So regarding the search engine, I would like to show you now how can you make the most of it so that you can find what you are looking for. As I mentioned before, keywords are terms that can help you narrow down the information about a specific topic. So imagine you are now a project manager in your ERN, you are starting a project and you are not very sure about how to address patient partnership in that project. So you wonder, maybe in the hub there is something about it. So I would like to type here project planning. Okay, so then I click intro and automatically I will get here all the resources that I have with that keyword. I must say that sometimes the keyword is a bit temperamental. So if you are missing a letter or an S or something, it will not work. So you need to make sure that you put the exact word, let's say. So this is something that we may improve in the future. We acknowledge it. So we will try to have a more intuitive search in that sense. But for the moment, for example, if you are that project manager, you can arrive here, type the project planning a keyword, and you will arrive to these two resources. One is a toolkit that you can use, and another one is a webinar on how to use on why listening to your community matters. So for example, I'm interested in this first tool. So I have a first kind of sneak peek of what is it about here, that this is a toolkit that will help me in project planning. And I just click in read more, and I will automatically be driven to the web page where there is information about that specific tool. I will be able to download it, and I will learn a bit more about that. So some of the links will give you will drag you to web pages. Some of them will be to YouTube. Some of them will be to podcasts. So it really depends on the type of resource. Then you can, when you finish your keyword search, you can just reset it by clicking on the little X. And again, here, all the resources will appear again automatically. You don't need to refresh or do anything. Another way of looking for resources, maybe you don't know exactly what you are looking for, but you know the area of work that you want to focus. So for example, here, the way it works, the hub, is that by default, you have everything ticked. So you need to remove those things that you are not looking for. Why is this? Because otherwise we would not have all these resources here by default. So this is the way we found so that we can have all the resources displayed at arrival in the hub. So for example, now I'm only interested in healthcare resources related. So I would untick the rest so that I only have healthcare. Visually, it's quite intuitive as well. You will see that only you have one ticked, and then automatically my results will show only healthcare related tools, all type of resource, because in here I have not touched anything. So in here you will find like a workshop toolkit and patient involvement in clinical practice guidelines. You are maybe looking into the handbook 13 for patient involvement in guideline development. You will also have some webinars of how it has been used. You will also have some templates on patient journeys, for example. So this is quite extensive, and you can navigate and browse and just get inspired of what is there. Then last option is to search by type of resource. So again, if you want to have all the result displays here, you would need to tick everything. So you make sure everything is active, and imagine that you just want to be inspired by what others have been done. So you want to see what good practices are out there. So you would just keep the good practices ticked, and automatically here you would see like the latest news on, for example, a podcast with about patient journeys that we recorded together with ERN, R&D, patient representative and project managers, or maybe some other webinars about some other projects, registries of Huracan. You see, again, you can navigate and get inspired by that. So now that, for example, we have this good practice tick, I want to show you how these search engines are interoperable. So for example, imagine that I'm looking particularly for a project that I know it was about outreach, was about information, but I don't know exactly what it was. I remember there was ERN Lang involved. So I would put here in my keyword ERN Lang, and now I have active keyword, area of work, type of resource, and there I arrived to the webinar I was looking for. Oh yeah, it was about patient partnership in outreach, Go is project by ERN Lang that was recorded May this year. So then I would click on that, and I will automatically be driven to the page where the webinar is the recording of the webinar is available. So finally, maybe one more feature of the hub is that you can also share the link to a specific keyword result search. For example, let me show you. If I'm interested in patient journeys only, well, I can also click here, patient journeys, and I will, yep, I need to, you see, I need to click everything again so that all the results show. And now I only filter by patient journey keyword, and I will have here all the results for patient journey. And automatically, because I have included a keyword, my URL has changed. So I can copy this and I can share with someone else that is interested also in, so for example, I have a group developing patient journeys, and I can share with them this link. Hey, look, these are the resources. Are we interested in something? Do you want to have a look? Or if you want like more specific link, you would need to be more narrow in the keyword so that when you, if I copy here and then I paste, then you would get only the results for that specific search. I think this is quite useful as well, so that you can share with each other specific resources that are in the hub. And also the person receiving the link, they also receive the link to the hub, so they can browse and they can explore and they can play around again with all the research engines that we have here. So I don't know if there are any questions so far about this.
There are some questions in the chat, Nora.
Yes, okay. Let me
Do you
see.
want me to read it?
Yeah, I can see them. Is the tool open for everybody or focusing on EPACs? Yes, the tool is open to everyone. It's actually dedicated to healthcare networks in general, particularly to ERNs, and the target audience would be patient representatives, healthcare professionals, and project managers, who are the key ingredients for patient partnership activities, let's say. I think that answers the question to Stephanie. Then I also see another one from Carolina Roata, who updates the resources and how often. So I will address this topic after about the sustainability of the hub. Good point, Carolina. I don't see any more questions. Any hand raised?
No.
Okay, so then I will go back to the presentation. There you go. So what's next? Where are we also and what's next? So we have disseminated the hub via our communication channels. There is a dedicated news item in our website explaining a bit more about the hub. And also we have posted in social media about it. We have created a little intro video. So if you find the hub useful, we ask you to please disseminate and also let the others know that this is available out there for you and that you can use them. And I will circulate these slides with you after, so you will have also the links to all these communications materials, and let me know if you need any more. You can always drop us an email to the email address on the slide, and let us know if you need anything else. From our side, we will also keep disseminating, as well as we are also working on how to make the resources that are already out there even more used by you. So we are also thinking of preparing little short videos that will be with some of the resources, like another link on how to use this resource, a very short explanatory video. This was highlighted in the survey about the use of EURORDIS tools that we disseminated among you, and from you we heard that you would really like that feature there. So this is something that we will include in the hub, hopefully soon. And then regarding also to the question that we had in the chat from Carolina, just to finalize that the resources included in the hub are usually not condition related. So you will not find a patient journey for a specific condition, but you would find templates and webinars on how to develop a patient journey. So they must include a clear methodology and show how clinicians and patients have collaborated to achieve a given outcome, or provide guidance and tools for that so that they can serve to inspire others. New resources need to meet this criteria, and if you have any in mind that you think might fit in the hub, please let us know. Again, you can write to us to the email displayed on the slide, or let us know in the chat, and then we will have a look. And in order to ensure the sustainability of the hub, we have put together a protocol of usage, and we will run monthly checkups of the resources, if there is something to be included, if there is something to be edited, if there is something to be removed. And we will also run like a yearly thorough check of the content of the patient partnership. So this is something that we will do from the EURORDIS side. However, in case of any challenge or any doubt, we will always come back to the knowledge management working group to look for answers and common opinions, let's say. So yeah, I think that's it from my side. Do you have any more questions, or we still have, like, we are just in time, we have 5 minutes, if you want to let me know your thoughts also. Maybe you can share already, like, what you think from them. I really encourage you, like, to just go there and play around with the filters and see what is there, so that you can have a taste of what you can do with that. And please, if you find it useful, share with your community, with your project managers, with whoever you think it will benefit from this information.